Good evening, everyone. I am Swaraj and I welcome you all here. So, Life Science Education Trust is a specialized skill development and learning center for youth enthusiastic about pursuing a career in animal care and management. Today, we have gathered here for an insightful webinar on nutritional deficiency in exotic birds by Dr. Abhishek Gupta. Dr. Abhishek Gupta has done Bachelor of Veterinary Sciences and Animal Husbandry from Bangalore Veterinary College. Sir has 8 years of experience in small and large animals, also 1.5 years of experience in exotic animals and birds. Sir was associated with many NGO and was active in rescue and rehabilitation of small animals. Presently working with Paradise Average since January 2021. So welcome, sir, and I would request you to please start the webinar.
Thank you. Good evening, everyone. So today's topic is common nutritional deficiency or ailment in the exotic birds. So we'll start.
Yes, sir.
Yeah. So first of all, I want to tell you why nutritional deficiency happens. See, most of the exotic birds they like seed-based diet. They like to eat more of seeds. So because of that habit, there are like many deficiency of vitamins and minerals which they can get from the fruits and vegetables, and it's very hard to replicate their diet in the captivity. See while they eat a variety of seeds, variety of fruits, variety of raisins, but in captivity it's very difficult to replicate the wild diet. Again, the negligence of feed. Sometimes we overfeed the bird, sometimes we underfeed the bird, and most of the time pet owner or bird owners, they think that whatever they are feeding is the best, but it may not be the best food for the birds. So typical signs of nutritional deficiency is obesity. So obesity generally happen when birds are completely on seed-based diet, which are rich in fat. Flaky beak and scaly skin. Flaky beak and scaly skin, sometimes it caused due to vitamin A deficiency and vitamin B deficiency. Softening of the claws and beaks and allowing the beak to overgrowth. So this happens because of calcium and phosphorus metabolism imbalance. Poor plumage both in form and the color. So generally poor plumage we see in the deficiency of vitamin A. Delayed or incomplete molt. Delayed and or incomplete molt also we see in the deficiency of vitamin A. Convulsion or muscular weakness. Convulsion and muscular weakness we see in the deficiency of calcium, vitamin D3, and muscular weakness also we see in the deficiency of vitamin E and selenium. Lethargy and inability to fly. Lethargy and inability to fly we see in the deficiency of vitamin I, vitamin A, and calcium and phosphorus imbalance. Lipoma again happens because of more seed-rich diet, which are rich in fat. Upper respiratory tract disease, very common in vitamin A deficiency. Conjunctivitis, again, it's very common in vitamin A deficiency. Reduced resistance to disease, like a low immune power, low immune system is very common in vitamin E deficiency, vitamin A deficiency, and iodine deficiency also. Inability to breed, lack of libido, egg binding, infertility, eggs and deformed baby birds we see in the deficiency of vitamin A and vitamin E. Obesity. See, if your bird is like 20% overweight to the actual weight, we consider it as an obese bird. Galas, parrot, macaws, Amazon and Quaker parrots are very prone for the obesity. May become lame or have difficulty breathing. See, if birds are obese, definitely they will have a problem with like perching, or they may show the lameness and difficult breathing because of excessive fat surrounding the abdominal cavity that reduce the space for the air sacs. Then they have a difficulty in breathing. The obese birds are very prone for arthritis, fatty liver disease, coronary artery disease, and heart disease. The solution for this is pellet-rich pellet diet, but in controlled proportion, and we can provide them large cages with multiple dispersed bowl so that they can fly around and they can have enough exercise. We'll talk about vitamin A deficiency. Vitamin A deficiency happens mostly if birds are on seed-based diet, completely on seed-based diet, because seeds lack in many amino acids, vitamin A, and there is a calcium and phosphorus ratio imbalance also. Most of the seeds are low in calcium and high in phosphorus. That leads to the calcium and phosphorus metabolism imbalance. Underlying cause of vitamin A deficiency is pododermatitis, sinusitis, and conjunctivitis. Vitamin A deficiency causes hyperkeratosis of many organs like reproductive system, like digestive system, and the respiratory system. And because of vitamin A deficiency, the mucosa or mucosal gland and the salivary gland, they form a there is a crusty lesions formation over that, and there is a swelling of the glands, and because of that we see all these lesions like sinusitis and conjunctivitis. Symptoms are nasal discharge, sneezing, swelling around the eyes, difficulty breathing, increased drinking, and urination. Poor feather quality, feather pecking, and anorexia. Poor feather quality we see because vitamin A is a precursor of carotenoids and beta carotene. See, if birds are lacking in vitamin A, so there would be a not enough conversion of carotenoid into beta carotene, and that is responsible for the plumage color. And yeah, so because of that, we see the we see poor feather quality, poor coloration of feather, and other feather ailment. White plaque around mouth, eyes, and sinuses, as I told you, because of hyperkeratosis of the oral mucous membrane and other GIT membrane, mucosa. We see the plaques around the beak, mouth, and sometimes we see the ulcers also in the mouth. Some birds like lorries and lorikeets need decreased quantities of vitamin A. Why? Because vitamin A, if we are providing in excess, that helps in the iron storage disease. That we'll talk about, talk later about the iron storage disease. In the birds, if the bird is not on a pellet diet, the following mostly cover the vitamin A deficiency. So most of the greeny vegetables, chilies, broccoli leaves, melons and flowers, sweet potato, turnip leaves, colorate greens, liver, egg yolk, beetroot, and spinach are the good source of vitamin A. So we can incorporate all these things into their diet. Now, on calcium, phosphorus, and vitamin D3 imbalance, seed diet, again, as I told you that seeds are very poor in calcium and phosphorus ratio. See, if birds are completely on seed diets, there would be a imbalance in the calcium and phosphorus metabolism. We can see this thing in chicks and the adult birds also. Most of the seeds are very poor in amino, they lack the amino acids, mostly lysine and methionine. Sunflower and safflower in low in calcium but high in fat. So again, it causes a calcium and phosphorus imbalance, and it can cause the obesity also. Metabolic disease, bone disease, we see, and hyperparathyroidism we see in both chicks and the adult bird. Metabolic bone disease mostly we see in the chicks. Hyperparathyroidism mostly we see in the adult bird. Hyperparathyroidism is the hyperparathyroidism we see if there is a calcium imbalance, then parathyroid gland start secreting more calcitonin and parathyroxine hormone, that again leads into the calcium imbalance. African grey parrots are prone for calcium deficiency and vitamin D3 deficiency. There is a malformation of long bone and vertebra. It's very commonly seen in the African grey parrots. Acute hypocalcemia, again, it's very common in grey parrots. So we can check acute hypocalcemia by the blood test. And the symptoms of acute hypocalcemia are weakness, tremors, inability of perch, suddenly bird fall from the perch. We can see the seizures. Remedy for this is calcium supplement and exposure to the UV spectrum. We can give them subcutaneous calcium borogluconate. Iron storage disease. Iron storage disease is very common in soft bills, especially toucans, ballymanas, thuracos, and sometimes in lorries and lorikeets also. So what is iron storage disease? See, iron is very important precursor of hemoglobin. So, but if we have more dietary iron, so what happens? The more excess dietary iron stored into the liver, that cause the liver liposomal liposomes got idolized, and there is a free radical form, that is the iron free radicals, that again destroy the membranes or to the liver membrane and cause hepatic failure. Symptoms for iron storage disease is weight loss, depression, distended abdomen, fluid accumulation, breathing difficulty, and circulatory disturbance. It's common in myna, toucans, lorikeets, thuracos. Food low in irons are peaches, plums, honeydew melon, apple without skin. Food high in iron, but we can give to the acceptable range. Within acceptable range, we can give banana, mango, papaya, summer squash, boiled potato without the skin. Foods to be avoided, which are very high in iron, it's baby food, juices, nectars, and primate biscuits. The additional nutritional concern is right side heart failure. It's because of completely seed diet, which are rich in fat. Hepatic fibrosis and cirrhosis, again, because of seed diet. And because of pet grade peanuts, which contain aflatoxin, that cause a hepatic fibrosis, hepatic failure. Low palatability of vitamins and minerals, supplement in water, that cause low intake of water and can cause dehydration to the bird. The long-term remedy is we should increase the foraging activities to the bird. We can provide multiple food bowls in different places so that bird have enough exercise. And we should provide them more of green, more of vegetables, sprouts, and fruit diet, and less of seeds. Kids, yeah, multiple small, foraging toys and natural sunlight. Natural sunlight is also very important for the vitamin D3 metabolism. Apart from this, we have vitamin E deficiency. Vitamin E deficiency happens. Vitamin E deficiency happens when we give them stored feed, stored seed, especially which are rancid. That makes vitamin E unable to for the bird consumption, like for the absorption of for the bird gut, and it leads to the vitamin E deficiency. Selenium and sulfur containing amino acid deficiency also leads to the further vitamin E deficiency. Vitamin B deficiency is very uncommon, but because vitamin B birds can like they can form vitamin B complex in their gut, but sometimes we see vitamin B deficiency that cause poor plumage and sometimes the muscular dystrophy also, and sometimes the convulsion and neurological symptoms. Thank you. If you have any question or any doubt, please you can ask me.
Yes, you can either like unmute your mic and I can ask, or can type on the chat box.
Sir, I have a query regarding Zika disease in birds. Basically, the birds start light and their keel bone, rather I would say chest bone, becomes very sharp, and the birds become very lethargic. So, what's the best treatment for them, and how to save the bird from being dead?
Yeah. See, Suka disease is not a disease actually. It's you can say symptoms. You can see the bird with a prominent keel bone. So first of all, we should know the cause behind that. So it could be a nutritional deficiency. It could be a bacterial infection because of bacterial infection, fungal infection, or a parasitic infection. So we need to go for some diagnostic test. So with the diagnostic test, we will get to know whether bird is having a parasitic infestation or a bacterial disease or a fungal disease. After that, we can start the proper treatment. But if you see birds is not able to eat by its own, then better to hand feed the bird and better to consult your veterinarian.
Okay, thank you, sir.
Hello, Abhi. Can you hear me?
Hello.
Hello.
Haan, Ram, yeah. Hi.
Yes, Abhi, how are you doing? Yes. I have a question. Like, actually, I don't. I want to replace calcium. I mean, like, I don't want to give a calcium syrup. So, how can
You are not audible, Ram.
provide natural calcium for the birds?
Ram, your voice is breaking.
Actually, I don't want to. Give a calcium syrup to me.
Okay.
Is it audible now?
Yeah. Tell me.
Yes, I don't want to give calcium syrup to my birds, but I want to provide a calcium. So, like, what do you recommend? Like, what can I do to provide a better calcium, like other than a syrup?
Yeah. So, see, if you don't want to supply calcium in the form of syrup or in the form of medicine, then you can give them cuttle fish bone. You can provide them grit, and you can provide them boiled eggshell powder. So that is a natural form of calcium. You can provide that. That will also take care of the calcium requirement of the bird.
Okay. Thank you, Abhi. Thank you.
Good evening, Dr. Abhishek. Am I audible?
Yes.
Yes, sir. So my question is to prevent all these nutritional disorders, what do you suggest? Like feeding the food which are rich in these vitamins and minerals, or providing supplements daily, like vitamin syrup or calcium syrup?
See, again,
Which is best?
it's very difficult to change the diet for adult bird. See, if you are having a chick, hand-raised chick, you can provide them pellet form of diet, which is like a kind of balanced diet. Okay, but if you are changing diet for an adult bird, it's very difficult because sometimes they do not accept the vegetables and fruits, and they will like more of seed. So in that case, definitely external supplementation is required for them. Okay, and if you want to like prevent the nutritional deficiency, slowly introduce the vegetables, greens, and fruits to your birds. So it may take time, but over a period of time, they will have a habit of they will start eating the fruits, vegetable that will provide them enough nutrition and like vitamin and minerals. But if you can get a pelleted form of diet, that is also good. You can shift their diet from seed to the pellet form.
Thank you, doctor. Can we also use hand feed raising formula for the adult birds?
You can, but see, again, feeding formula, they will not eat by their own. So either you have to give them with the crop needle, or see, if bird is not tamed, then it's very difficult to give them hand feeding formula, right? So, and hand feeding formula is not advisable for the healthy bird. if bird is not eating anything and if bird is sick, then hand feeding formula is very important to provide them instant energy. But for a healthy birds, no, it's not recommended.
Thank you, doctor.
So there is a question in the chat box. What diet is best for a clipped winged bird?
Pardon?
What diet is best for a clipped winged bird?
Clipped wing bird. See, again, whether bird is full winged or clipped wing, it doesn't make sense of it, like change of diet. It doesn't make sense. So just first of all, you should see the what we should see what birds you are having. See, if you have lorikeets, then definitely they need more of fruits. They don't eat seed. If you have budgies, they eat mostly small millets and less of fruits, vegetables. They eat sprouts. Generally, they eat. And if you have any other macaw and cockatoos and all, they eat mixture of fruits, vegetables, seeds, and nuts. So depending on the bird, so clipping of wing or full wing, it doesn't make any difference of like diet, changing in diet.
What is the best fruit for vitamin C supplement?
Vitamin C, citrus, and especially chilies are very good source of vitamin C. And again, vitamin C helps in the absorption of iron. So we should avoid excess vitamin C rich food in case of lorries, lorikeets, and the soft bills. But in other birds, the rich source of vitamin C is chilies, citrus fruits, etc.
What is the line of treatment for hyperlacrimation and hair loss around eyes, sir?
Hyperlacrimation, again, it could be a reason of keratitis of eye, conjunctivitis of eye, or it could be some kind of irritation. So first of all, we should rule out why hyperlacrimation is happening. See, hyperlacrimation is a sign, not a disease. So excessive see, if there is any irritation to the eye membrane or retina of the eye, definitely you will see more of eye secretion. So first of all, we should know whether what is the actual cause of hyperlacrimation. See, if it's because of some dust allergy or if it's because of some feather, if a feather is irritating the eye cornea, then we should rule out that. And if it's because of some infection, fungal infection or bacterial infection, we have to use eye drops. And if it's because of vitamin A deficiency, as it causes the conjunctivitis in eye, then we should provide them vitamin A supplements.
Okay. Why does proventricular dilation disease occur? Is it related to dietary insufficiency or toxicity?
No, PDD is a viral disease caused by coronavirus, and generally, it's almost all viral disease is very difficult to treat. So we can treat them only symptomatically and with antiviral medicine definitely. So in case of PDD, management play a very important role. We should feed very small quantity at a time. We should not provide large quantity of food at a time. So PDD is not because of nutrition deficiency, it's a viral disease.
I have a chicken, Kadaknath. Few of the hens have been molting, but I provide them with syrup calcium and eggshells. What to do to prevent this thing from happening?
See, molting again, depending on, see, sometimes it could be a seasonal molting, and sometimes molting happens because of external parasites. If they have lice, if they have mites, that also cause the molting. And deficiency, vitamin A deficiency, vitamin B complex deficiency also sometimes cause the molting. Provide them proper nutrition. Just check for the any external parasite. That will help you in the preventing the molting of the birds.
Okay. Sir, what is the dose of calcium borogluconate for hypoglycemia conditions
Calcium.
in bird? Calcium, yeah. Okay.
See, again, depending on the bird size, bird body weight, whether you have a small conure or a big macaw. So generally, we provide 1 to 2 ml mixed with the normal saline, and we provide them subcutaneously. Generally, it's 100 milligram per kg of body weight.
What does proventricular dilation disease of it is? Okay, it was repeated. Sir, please tell the source of vitamin A in raptors. We have rescued kite in our OPD.
Okay, raptors, see, again, they are carnivores, so fresh meat is also good source of vitamin A. You can give them fresh chicken, you can give them egg, boiled egg, and this dairy products also, and meat products also, they are a good source of vitamin A. So any kind of fresh meat is you can provide them.
If
we cannot expect raptor to eat fruits or vegetables, so definitely we have to give them a fresh meat or fish. Yeah.
Okay. So if pododermatitis occur in raptors, so what's the treatment in captivity?
See, pododermatitis, if they have pododermatitis, then we should like, first of all, we should provide them soft bedding and soft perch to hold on, and we can do the bandaging to provide further damage, and we can provide them, as I told you, pododermatitis may be the result of vitamin A deficiency. So with external source of vitamin A also helps in the to cure the pododermatitis.
Why birds are picking their feathers and what to do once they are plucking only newly pinned feathers?
See, picking of the feathers could be because of stress, could be because of external parasite, lice, mice, or fleas, and it could be because of deficiency, vitamin A deficiency. So see, generally, if a bird is picking a feather, you provide external source of vitamin A, and then provide them more of like we should provide them more of like twice. We can provide them twice. We can provide them big cage to so that bird can engage in other activity. We can give them more of branch, more of like we can give them whole fruits to nibble that. So see, that is because of like bird in stress, they don't what they do, if bird is in a small cage and they don't have work to do, they start picking their own feathers. So like, it's a combination. We should provide them big cage, we should provide them more of branches or twigs to play. We can provide them twice. Yeah, so that also helps. And if it's because of external parasite, then we should look into that, and we can provide them any like medicine for the external parasite.
Sir, can we use calcium in sandos in hypocalcemia?
Calcium sandos, yes, because it's again contain calcium borogluconate. We can use that.
Eye drops for conjunctivitis of bacterial and fungal origin.
See, bacterial origin, we can use getifloxacin, we can use ciprofloxacin, and for fungal origin, again, we don't get like eye drop with the like, so we should give them oral antifungal medicine.
Okay. So why they pick only newly pins why they pick only newly pins and chew them?
See, because when they get newly pin feathers, that time they get kind of irritation, and they like, because of it's soft, and they try to chew that only. So see, there is no science behind that. Maybe because they get because it's soft, they chew that, and because they get some kind of irritation when it comes off, then there is a possibility of chewing that also. Because of that also, they might chew that feather.
I try cutting fruits and veggies in different shapes and I hang them sometimes, but all they want is seeds.
For that, better to grate the fruits and vegetables, or you can parboil the vegetables and mix it with the fruits and sprouts. And seed again, you provide for very limited period, maybe half an hour, 1 hour, or 2 hours. Do not leave seeds for overnight. That will enhance the again seed eating habit. So, like, see, again, birds they have a particular feeding time. Either they eat in early morning and evening hours. So you can provide seed in between for very few time, like a few hours. That will enhance the feeding of vegetables and fruits and sprouts, and definitely it will decrease the seed intake.
My cockatoos never eat anything except seeds. I give them sprouts, boiled egg, fruits, and veggies, but they don't touch them. Yeah.
Okay. See, as I told you,
I encourage them.
as I told you, it's very difficult to change the diet for adult bird. See, over a period of time only you can change the feeding habit. But if you think that you are giving today and bird is not eating, and then tomorrow you are not giving, so that is not a solution. You should provide them the same kind of diet for maybe for 10 days, 15 days, or for a month. Then only they will start picking the food. So, and if you are providing, see, if bird is not eating fruits, and if you are the next day, if you are providing only the seed, definitely bird will go to the seed. And again, any kind of change should be very gradual. Start a small quantity of fruits or vegetable. You can give multiple color of like you can give different colors of vegetables, greens, boiled egg, grated fruits, grated vegetables. That will enhance the feeding habit of the bird.
My green chick conure eating its own eggs. How to come from that?
See, it could be a eating their own eggs. It's not a deficiency. If they are laying a complete formed egg, if it's a soft shell egg, then we can say it's a calcium deficiency. But if they are laying completely formed, completely healthy egg or completely shell formed egg, then it could be a bad trait in the bird. So it's not related to any deficiency.
Best dewormer for birds.
See, we have a worm out gel which contains praziquantel. We have one more which contain ivermectin and praziquantel combination. So I don't remember the product name, but I'll if you want, I can share you later on.
Okay.
So
how to overcome skin irritations and how to allow them to take bath when some are afraid of water and don't want to take bath in big bowls.
Yeah, so if the bird is not liking to take bath in a bowl, you can use sprinklers, or you can use foggers, or you can use just hand spray to mist them out. That will prevent the irritation, and that will improve the feather quality also. Again, it will take time. See, sometime when we introduce any new thing, bird will not accept readily. So it will take time, but slowly over a period of time, they will enjoy that.
What is the dose of deworming and schedule?
Yeah. See, again, depending on the what product you are using, generally worm out gel, there is a prescribed dose in that. We take a 1 ml of worm out gel, dilute with the 9 ml of water. So we make a 10 ml of stock solution. That 10 ml of stock solution, we give 0.5 ml of that stock solution per 100 gram of bird.
Can you please tell the ecotopracidial drugs?
Ectoparasite.
Ectoparasite.
So for ectoparasite, we can use spot on. We have a scat. We have you can use ivermectin drop also. We use sometimes we use fipronil spot on also for birds, but it's not advisable. Then the safest ectoparasitic drug is ivermectin spot on. So you can use ivermectin spot on or scat.
Abhi, I have one more question. Hello?
Yes, tell me.
Yes. Like how often we can feed egg?
How often we can feed egg?
Yes.
So
exactly.
weekly, twice or thrice, you can feed the grated egg.
Okay, including the shell?
Shell, again, depending on how you are feeding. If you are powdering the shell, then you can give on daily basis also. You can mix with the soft food, small quantity of eggshell powder, and on daily basis you can feed that.
So I have one more question. For which birds we can feed eggs and for which bird we cannot feed egg?
For?
Like of course take parrots. Like for which parrot species we can feed egg and for which parrot species we cannot feed egg. So for few species feed egg and for which parrot species we cannot feed egg. Like a few parrots, for few parrots we cannot feed more protein, right? So
yes,
can you
yes.
tell that? Yes.
Yeah. Yes. See, generally, macaws and all, they required fat and high protein diet. So for macaw, you can feed the egg on daily basis, grated egg. For African greys, you can feed that. Conures, sometimes you can feed that eggs and all. And especially finches, you can feed grated egg in the soft diet. Yes.
And eclectus, what about the eclectus?
Eclectus diet, I don't know about much about the diet of eclectus, but if you want, I can research on that and I get back to you.
Please. And for cockatoos?
Cockatoos, we can feed them.
Yes. For eclectus, I am not feeding egg, so I have that doubt. So please do some research.
See, we have few pairs of eclectus over here, and in soft food we mix the egg and we give them. But actually, what they require, I don't have proper idea on that. If you want, I'll just search. I'll research on that. I'll get back to you.
Actually, I hear like eclectus don't need more fat and protein.
Yes.
Hello. Yes, I hear like we cannot feed more protein and fat to the eclectus. So that's why like I want to clear that doubt.
Okay, fine. Thank you. See, it's good for me also. I'll just go and search on the eclectus diet, definitely.
Okay, Abhi. Nice. Thank you.
Sir, couple of people are asking schedule of deworming.
Yeah. So generally, it's like the same for as we deworm our pets every 3 months once. We should deworm our pet birds also. And depending on the if you have birds in open aviary where they have access to the mud, and if birds are in colony, if they have access to the poop of different birds, then on a regular basis you should do the direct fecal examination, and depending on that you can prepone also the deworming schedule, but generally recommended deworming schedule is 3 months once.
Sir, can you advise the quantity of ivermectin to be used on?
Ivermectin, depending on which species you want. for if you want to inject ivermectin, then the dose is vary for different species. It start from 0.002 milligram to 0.02 milligram, depending on the species. But if you are using as a spot on, 1 drop ivermectin you can use for a small bird, and 2 drops for a medium bird, and 3 to 4 drops for the bigger bird.
Is soft food good in summer season?
No, because it's very prone to for rancidity, and soft food is spoil very soon in summer. So we should not provide for soft food for longer period in summer time. See, if we are providing vegetables and fruits in morning hours, then after 2 to 3 hours you should change that. You should not keep for longer period, especially in summer.
My cooperative okay, sorry sir.
But again, see, we cannot say that we should completely avoid giving soft food in summer. We can reduce the time of feeding, but it's important. Hello.
Yes. My cockatiel has hatching properly, but chicks get died after 2 to 3 days. Please advise what could be the reason.
See, first of all, you see how they are parenting, how they are feeding their chicks. If they are not good parents, if they are not feeding, definitely chicks will die. So if they are hatching properly, you can take the chick for hand feed and you can hand raise cockatiel chicks.
Can we use levamisole as immune modulator?
We can use levamisole is a dewormer. We can use as an immune modulator also.
Eucalyptus needs high fiber diet because they have much larger intestines. Their digestive system is different than other parrots. Eucalyptus should get maximum veggies, small amount of fruits and specialized pellets. It's from Prasad.
Yeah. Thank you, Prasad. Thanks for the information.
Dose of levamisole, sir.
Dose of levamisole, I have to check. If you want, I'll just message in the comment box.
Any other questions?
Yes, I have one more questions. Like, in which form we have to give the vegetables, like raw vegetables, boiled vegetables, or steamed vegetables? How you prefer?
Raw? Yeah. I tell
which
you.
is
See,
the
raw.
best way?
Yes. See, in wild birds generally they eat only raw vegetables and fruits, but in captivity it's good to, because they don't have enough time and enough place for exercise. Then it's advisable to give them parboiled vegetables, because that improves the digestibility and helps in the digestion. See, again, if you are giving completely cooked vegetables or like vegetables, that like they lack in the nutrition, because many vitamins destroy during cooking. So you can always give them parboiled form of the vegetables.
So you like steamed vegetable, right?
Pardon? Hello.
Sorry, hello?
Yeah, steamed
Hello?
vegetable or parboiled vegetables, correct.
Steamed vegetable, right?
Yes.
Hello?
Yes.
Yes. Okay.
Okay, so there aren't any more questions, sir.
Yes.
I would like to thank you for such an insightful session where we all gathered so much knowledge on nutritional deficiency in exotic birds. It was a wonderful session, sir.
See, someone was asking about the levomethol dose. So levomethol dose start from 2 mg per kg body weight to up to 40 mg per kg body weight. Again, depending on the bird species. So we have to refer the book for the species wise. So it can range from 2 to 40. So we have lot of difference in the dose, levomethol dose. So it's depend what species you want levomethol. So and again, if you want as an immune modulator or you want as a dewormer, depending on that also the dose varies.
Thank you very much, sir. It was a wonderful webinar.
Thank you. Thank you so much.